right and left sphenoparietal sinuses, right and left cavernous sinuses, right and left superior petrosal sinuses, right and left inferior petrosal sinuses, superior sagittal sinus, occipital sinus, right and left transverse sinuses, right and left sigmoid sinuses, basilar plexus, the nerves, cranial nerves. Cranial nerve number 1, olfactory, that is olfactory bulb, that is olfactory tract. Number 2, optic nerve. Number 3, oculomotor nerve. Number 4, trochlear nerve. Number 5, trigeminal nerve, and this is the trigeminal ganglion, and it divides into 3 branches. The first branch is ophthalmic nerve, the second branch is maxillary nerve, and the third branch is mandibular nerve, middle meningeal artery. This is number 6, abducens nerve. Number 7, facial nerve. Number 8, vestibulocochlear. They exit through internal auditory meatus. Number 9, glossopharyngeal. Number 10, vagus. Number 11, accessory. And this long branch is the spinal accessory, which comes through foramen magnum. And this is number 12, hypoglossal nerve, exit through hypoglossal canal, the arteries of the brain. Here is your internal carotid artery, which splits into anterior cerebral artery and middle cerebral artery. The 2 anterior cerebral are connected by a short trunk called anterior communicating artery. Here is the posterior communicating artery from internal carotid, joins the posterior cerebral. These are the 2 vertebral arteries coming through the foramen magnum, and they join to form basilar artery. The basilar terminates as right and left posterior cerebral arteries. Inferior to posterior cerebral, superior cerebellar artery. And then you have the pontine branches, small branches arise on either side of the basilar. Labyrinthine artery, which supplies the internal ear. Then you have the anterior inferior cerebellar artery. From vertebral, you have the posterior spinal artery and posterior inferior cerebellar artery. This is the pituitary fossa. This is the stalk of the pituitary, which is called infundibulum.